Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
We are on. Hello, Manuela. How are you?
Hello, Andre. Yeah, I'm fine. Good, thank you. You? How are you?
I'm fine. We've been recording now about twice a week, right? We've been getting the
Yes.
taste of it.
Yeah, but we had also a long vacation, huh?
Yes,
This
which is good
December
also.
and New Year's. But yes, it's nice. It's nice to be back.
When we were talking just before we started this, we were discussing in Portuguese I was talking about how things are easier on vacation, but then you start to work and you need to deal with stuff, and you need to deal, and dentistry, very often you need to deal with people, right?
Very often, yes.
Not only the patients, but the staff. There are many dentists that say that the biggest issue in their life, the ones that lead dental practices, the biggest issue in their life is not the patients, is actually the staff, right? So dealing with people in dentistry, like my good friend used to say, dentistry is a bunch of people locked in a room with sharp instruments, treating other people that are completely afraid. So it's a recipe for a lot of issues. And we were talking, and the title of this episode is The Art of Confrontation, or the art of having to have conversations with staff. We would say confront in a violent, not in a violent way, of course, nor emotionally, nor physically, of course. But sometimes there needs to be some healthy confrontation, and it's a burden for many of our colleagues. And you were talking to me about your journey, and we were saying that maybe I came, and we were saying that everybody's a little bit afraid of confrontation. I mean, this is what I believe. Everybody's is afraid of confrontation because we are human and we want the status quo to stay. We want the energy to be kept. We don't want to create an issue. Some people, I would say that most people are afraid or want to avoid confrontation. I mean, we all do. And we were talking that maybe my journey was I was maybe more confrontful or more reactive, and I'm trying to balance more. And you were telling me that you came from the opposite side. You were a confrontation avoider, right? Can you tell us a little bit about that?
Yes. Actually, when I started to learn more about communication and to do some courses about communication, and never forget one of the persons that was talking, saying, "What is the most easy way to resolve a difficult conversation?" And everyone was giving their ideas, and then the answer was to avoid it. So that's the most easy way to resolve a difficult conversation. And that for me was like, yeah, that is the way that I deal with difficult conversations and confrontations. I avoid it. So, and I realized also that confrontation for me, it was a trigger. It was a stress trigger. It caused me anxiety. I had a rush of adrenaline. Days before a difficult conversation or a conversation, and I was very, and I was very. That resulted in me being very passive. So to say I was not able to, in order, I when I could not avoid the conversation, then I avoided the confrontation by just saying yes. So by not being assertive, for example, about my boundaries, and then on the other hand, made me,
Sorry, Manuela.
yeah.
Can you give me an example in dentistry of when you would have more of that passive attitude?
Yes, I can give you a practical example. I remember that when I was still working in Portugal, there was this situation in the practice where I had to where I didn't had to, but I was invited to start working on Saturdays, and I was already not working on weekends, and I was not able to say no. So I
Yes,
listened,
that's so
and
typical.
yeah.
That's so typical.
So I felt like, and then I was going home, completely frustrated by not being able to say no, and also kind of mad with the other person because they didn't understood my situation, but they didn't have to understand my situation because I was the first one not explaining my situation, so I
Exactly. Yeah.
could not expect that. But
Yeah, because there's also that other layer which is, I mean, you
communication is
need
not
to
effective
present
both
some.
sides, so it
Exactly,
was not,
yeah, but
yeah.
also, for example, today there's another layer which would be, okay, I would probably say no, but you would have to explain and to give, and also to be, um, to try to understand the other side, but also give some arguments that make the other part realize that actually for you not to work on weekends was important, or because no one told you when you were coming here, or because we had some other extra activity, or because you are already working a lot of hours. So today, how would you respond to that, knowing what you know today? If you
Mhm.
could prepare if you could prepare that answer, what would you do today? What would be your steps
Well,
today?
like you said, prepare. I think that a lot of the what can be done about turning confrontations from a negative perspective to a positive perspective is the preparation. I think that is very important if you're going to have a difficult conversation, for you to prepare yourself for that. Not in order for you to attack the other person or to be prepared to attack, but in order for you to be really assertive for what you want from the situation and how do you feel, and to be really sure that you are able to express that, and also, I mean, this conversation that I just told you, it was many years ago, and I'm not completely 100% sure that what I'm going to say is exactly how it happened, but I'm almost sure that I had this conversation already in a point after avoiding it, because first I always avoid it. And by avoiding it, it only makes the emotional part, it makes it bigger. It makes it bigger. So nowadays I don't avoid anymore. I'm much more assertive. Every time I feel something in me that, because a difficult conversation or a confrontation is one where you are worried about an emotional reaction from you or from the other person. And for me, whenever I feel that something is not right here, this should be said, or I should talk to this person, or if I want to avoid this, then I must say or immediately that, sorry, weekends for me are not, I'm not available because of this or this. Or if it must, then, for example, I have to take a morning off during one of the day of the week, but I'm the first one to say, is this going to happen? Because if this is going to happen, let me know. I need to be prepared, because at this moment I'm not prepared to work on weekends. And I'm sure that, I don't know, this conversation was more than 10 years ago, that I probably avoided this conversation until a point where I could not, So nowadays, the big difference is that I'm much more assertive about what I'm feeling, and I act on those feelings, which are usually right. So I learned that those feelings, when you feel something, when you feel like, okay, this is heading in a way that the practice is going to start working on weekends. Do I want that, or don't want that? And so I'm the first one to give that step, and when I have the conversation, even on that first step, I'm much more prepared for that. I'm much more prepared. I try to see the things from a positive perspective. What can I bring to the table? How can I make this conversation reach a solution? So basically, for when I now hear the way that I was able to turn confrontation and to lower the trigger of confrontation is turning it into a solution. Okay, so what do I want to bring to this situation? And also, my reactivity also lowered when I started to, and just like you said, to see the other person side. So it's like almost like, and in the conscience leadership course, I give a model for difficult confrontations, and one of the basic things is just put yourself like you were a reporter, like you were like, I do this exercise, and I usually do it by writing, where I describe the situation like in a third person, like I'm a reporter describing the situation. And that for me, it's very useful, and is an exercise that I recommend to everyone. And because what I used to do in the past is that I took things very personally, and you did this, and it was almost like a blaming game, and I did that. And when you do this kind of exercises, you can take out the emotional part, because if we look at this kind of conversations and these confrontations, it's all very personal. I think it's all about us. We feel like we are being that people don't respect us, or that people don't like us. And when we prepare ourselves, and when we do exercises like this, we can take out the emotional part, and we can see things from a different perspective, and bring other solutions that you don't have if you are very emotional on the conversation. But yeah, I had to work on it. Because for me, it was really a trigger, and I was very passive on my confrontations.
And when you say you have to work on it, I mean, so first of all, like, you were aware there was an issue there,
Yeah.
right?
Yes.
So so
Yes.
so, so you because everything begins in awareness, right? And then you just start to actively try to see how would it be a
I
more
think I
balanced
think
way,
it's yeah.
maybe
I
overcome
think
some
it's
fears.
Yeah, I think it's awareness. I think it's non-reactivity. You have to work on your non-reactivity, and that comes with the development not only of self-awareness, but also of meditation practice gives you that, and also the development of emotional intelligence. And then it was also learning about it, because I mean, this is one of the things that we teach, and we talk about on our course. These things have communication, have techniques. So non-reactive communication, this is what we are
Yeah.
talking about. But yes, you're right, everything starts with the awareness. Because if you want to be assertive, I mean, if you want to have an assertive communication, assertiveness is much more than you being able to say no, or to establish your boundaries. Is for you to be able to act accordingly to what you are feeling. So first you have to be aware of what you are feeling. So the awareness is always the first step. And then I think that the second step is not action, but it's actually to pause. So not to react
Yes,
immediately.
that's very interesting. Yes.
Action comes in the end. Action comes in the end.
So I think that pausing, that space that you create, and then action, this is where most of us do the mistake. Sometimes we are aware, sometimes we are not aware, but some of us, we are aware, but we miss the pause section. We go directly to action, and sometimes we or directly to inaction, or the action of saying yes when you actually want to say no. So yes, I completely agree. I think the pause and the reflection, and because of the pause, I had a question to you, which is okay. So two different situations. One thing is, let's use your situation. Someone starts working a practice, and all of a sudden they ask them, "Well, can you come on Saturday?" And they do that at the end of the day. The manager says, "Look, well, we would like you to come on Saturdays to work. What do you think?" And the thing here is that you are caught when you are not prepared, right? And there are some other things that we're going to talk about, which is if you don't have that much working opportunity, you may feel that is like a little bit of a pressure, because if you say no, they will eventually retaliate in terms of giving some preference to some other dentist. So my question is, sometimes you are not ready to deal with a situation at that point in time. So on an ideal world, you would be aware, okay, I'm not ready to deal with this. Okay, can I take some time to think about it?
Yeah.
But which would be the ideal, right? But sometimes, like you say, I mean, it's easy for everybody for you to say yes, isn't it? So just
I think that it's
right?
like you said in
And my
continue.
point is, okay, you said yes, and then you go home and you regret. There's nothing wrong by sending an email on the next morning. Look, I said yes, but then I came home. I was thinking about that, and because of this, and this, I think I'm sorry, but I will not be able to. And we can also further discuss this personally. I think there's nothing wrong with that.
The same way, and I said you said it in a very correct way. I think in an ideal world, when you are caught by surprise in any kind of situation, you should always, if you're not ready, and if it's something that you feel, okay, I don't know if I'm comfortable with this or not, you should always give me some time. How much time do I have to think about this? But I think that if that does not happen, and if you have a reaction, usually the most common is a passive reaction. But and like you said, even if you say yes, nothing wrong with on the thinking about it and communicating in that you reach a different conclusion and you're giving your arguments. But also for the people that react in an aggressive way, because that's people that also are a little bit too much assertive or aggressive,
Yes,
and they're like, oh, and they explode immediately. No, and you are always disrespecting me, and of course I'm not going to do that. The same way, when you explode, you can also go home and you cool your head and you think, okay, I think I overreacted.
I I messed up.
I don't want to work on weekends, yes, but I think I was a little bit too aggressive. Let me write an email, just like you said, saying, look, sorry, I completely overreacted. I was caught
I'm
by
sorry. Yeah.
surprise.
I had a bad day.
And nothing wrong about saying sorry.
Yeah, yeah. I think that's a good distinction. And another thing would be what I was talking about, which is, let's imagine someone that is recently started to work, uh, and they are overwhelmed. They have a lot of work, a lot of stress, and someone asks them to do also weekends, and they believe, well, but if I say no, they may eventually retaliate me in a way like remove me some patients or stuff like that. So I feel obliged to say yes. And this is something that happens a lot. For example, in Portugal, I know it happens a lot on the public health service. on the specialty departments in public health hospitals. It happens a lot. There is this culture of the workaholic that you need. While you are doing your specialty training, you have to be available like 24 hours, which is, there's this culture that like the boss, it's part of the culture, the hustle culture, the be available for that. And that happens a lot in medicine, which I think it's, I mean, it's in one way, yes, you have to be available for emergencies and stuff, but I think it's in terms of work-life balance and in terms of mental health, it's very disturbing. But in dentistry, okay, so if someone is working and someone gives them a proposal to start to work on weekends and they don't want to, they don't feel like, they don't want to do that. So maybe I think that can be a better way of dealing with that. And I was just thinking that the ideal would be, whenever you get a work proposal, the ideal would be certainty would have been to for example, in the beginning when you get the proposal, just ask some questions. Look, I'm very excited about this. Thank you so much. So, what are you, and in the future, do you think about having me work on weekends? What would be the future? I mean, you don't need to have like a completely laid out future, but just try to understand what's the goal, because the more prepared you are, the better, right? And I think that also it's not only what you ask and what you say, but it's also the energy that you bring when you ask and what you say. Because one thing is to talk with a smile and reinforce the fact that you value to work in this place, that you value this person's professional relationship. And there are several ways of showing that: the way that you speak, the positive words that you use, your body language, etc. So I think it's also important to be aware of the energy that you are bringing to the conversation. Is it a positive energy? Is it an energy that is a collaborative energy, or is it a rejection energy? Is it a judging energy? So I think this is also very important, because it's not only what we say, but also the way that we say it. I mean, I can be saying exactly the same thing. Like, okay, so I can say, yeah, okay, yeah, I'll do the weekends. It's fine. That's one thing. And I can say, well, yes, that's perfect. I'm more than happy to do the weekends. I was thinking about something like that. It's completely different, the energy that you bring to the table.
I think it has to do with and with you also coming with this the energy that you were talking about. Also, it has to do with you also coming with an idea of finding a solution, like finding a common ground. I think that's important, and that gives that energy that you were talking about. And also, what I learned when I start shifting the negative energy to from confrontation to positive is, as also I started to see confrontation not as an uncomfortable experience, but a process that would benefit me and the other part, so that will lead to a solution, like I was telling you, and that for me shifted my energy, like you said. I was identifying with what you were saying, because and when I remember, when the confrontation for me was a trigger, it was because I was already, like with the negative energy inside, but what then the words on my mouth was like, yes, and I was like even fighting with myself. What I was feeling was not what I was saying, and it was like I was fighting with myself, and that fight, it was also with the other person, and it was like this negative interaction. But
I understand.
And now what I try is to by coming with the solution and trying to have a common ground with the other person, and by trying to be assertive on what I'm feeling, so I'm expressing what I'm feeling. I feel that positive energy that you are talking about.
Yeah, yeah. And one of the things that we are also talking, and that, for example, I think that if I have to choose my traits, I think that my evolution was actually on the other side, which would be I think I would be overreactive and I would be over confronting and less tolerant than I am today. And I think the reason for that is that my family, I was born in a restaurant, right? And the leadership style of my father was very confronting. I mean, it was not violent, but I mean, it's like it's the norm in restaurants. We all see the Gordon Ramsays and the Hell's Kitchen. I mean, there's this cartoon that everyone is aggressive and violent. It's not exactly like that, but there's a lot of stress in restaurants, and people are not very careful in the way that they talk to each other. It's like you are in the military, right? So I think that I gain a little bit of that background, and I don't think that is necessarily bad. And I think that the journey that I did was the opposite, to try to be more mindful, more aware, more to try to be more empathic, to try to be more focused on the solution and not that much focused on the problem. I think I was focusing. I was whenever I confronted some of my staff, maybe like 20 years ago, or even 15 years ago, I think that I would focus a lot on the problem. And this has to do also with age, with insecurity. You want to prove something, and I think that once you get some badges, once you get financially more stable, I think you get more secure, and you don't have the need for that. Because I think that aggressiveness in the confrontation, or not being very mindful or very too much focus on the problem, I think it's also a sign of insecurity. But having said that, one of the things that I see today, and I like this beginning of the year, because I'm very aware of my emotional state. I came from vacation, and I'm very aware, right? And that I'm full of energy, and I come with this energy that I want to fix everything. So there's energy for 20, 30 emails a day. There's energy to fix everything. And I have to slow down, right? Because on the other side, there are people that, okay, so, I mean, I know that I know the energy that he has, but let's just slow down. And I think that if we place these two opposites, I was writing this down here, which is on the one side, you are so aggressive that you actually disrespect your staff. And let me be perfectly honest here, it's very easy to cross that line while after you have seen 20 patients in the day, and it's like late in the evening. Let's be very honest here. In dentistry, I mean, you are not only the manager. Maybe you did like 10 surgeries, you saw 20 patients, and on top of that, you saw some things in your staff that you didn't like. And it's very easy to cross the line of lacking respect when you are confronting with someone. And I think this needs to be very clear, because I think that every leader in dentistry has gone through that, especially if you work long hours. So it's very easy to cross on that side, which is not desirable. The other side would be not also very productive, which is I am afraid of confrontation. I want to be nice for everybody, right? So I think that in this balance, what I see today is that I've made this shift, and I think society is forcing people to go more towards the middle. But I also believe, and this has very complex reasons. I think that today we are sometimes crossing that balance in a way that you are unnecessarily and in an unwealthy way, you are excessively afraid of everything that you say and that you do. And this is something that has been haunting me for years, let's say, which is, how do I find that balance? Because if I want things to be efficient, it's difficult sometimes to be efficient and to be always kind and to be always nice. Because when you want things to be efficient, you will find issues, right? Because efficiency is also by definition fixing problems. So you have to deal with problems, and sometimes problems that are human errors, right? So the way that you deal with those, that balance is a very difficult balance. So when do you cross the line? When don't you cross the line? And again, it's also sometimes not what you say, it's the energy that you say. And also not only that, is what if you make your staff used to be dealt with a certain energy, like you are afraid that you want to maintain that energy, or you don't want to mess up with the environment. If they are used to that, and all of a sudden you have a bad day, they will feel that. I mean, it's a very difficult balance, and it's a very hard balance. And this is one of the biggest reasons also why leadership in dentistry is very difficult. So I think that finding that balance is kind of an art. It comes with age, and it comes with practice. It comes essentially with errors, right? So looking back at myself, I think I did many mistakes, and I learned from those, and I'm much more balanced now. But like I was saying, I think that trying to be a perfect leader, trying to never mess up, is making us very afraid of doing or saying everything. And this accumulates inside. And I see that the way that you talk to someone now needs to be much more thoughtful than it was 5 and 10 years ago. And we've talked a lot about this, especially to newer generations, because they don't only want the financial condition, they don't only want the work-life balance, they also need to be treated with respect and fairness, right? And if you are a leader and you want to bring efficiency to the table, you need to really be very thoughtful. And that thing that you said, that you need to pause to evaluate, I think this is really important. The capacity to pause before you say something is really, really important. And but this is something that I think a lot in these days. And for example, whenever I find a recurrent mistake, for some of the doctors that work with me, or a recurrent mistake for some of the nurses that work with me, especially when I come from vacation and I'm full of energy, I really need to restrain myself, because otherwise I can easily, and sometimes it's not even disrespectful, it's just very frequent. Do you understand? Just I'm every day pointing out issues. And even though they are legitimate issues to point out, you need to balance those. You need maybe, yes, I saw maybe 3 errors from the staff today, but maybe today is not the time to tell them, because yesterday I also pointed out some mistakes. Does this make sense, what I'm telling you?
Yeah, yes, totally. I made some notes. I think it's what you said is it's very interesting. First, I think it's very important to distinguish efficiency from perfection. So, and we also already talked about the 80-20 rule. So you cannot aim for the 100%. You cannot aim for perfection, because otherwise you will always find something that it's not well done, something that can be done better. I think that's to make this distinction between efficiency and perfection. It's very, very important. And also another thing that you said that I think it's very interesting is one of the most interesting things about a confrontation of difficult conversation is to make that analysis, if is this worth having this conversation, is it worth having, and for you to make that analysis, you have to have that time to think, like you said, because when you analyze the situation with already some distance and already some perspective, you can, and when you see the situation, and when you try to see also the situation by the other person's eyes, and when you try to even see the situation like you were a third person, like I was saying, you might reach the conclusion that, okay, this is not a conversation worth having, because it's just to talk. If I would say this, I would just be focusing on the problem, and it's just a blaming game, like you did this and you were supposed to have done that and you didn't. So, and again, like you said, to have that distance and to make that analysis, okay, today these three things happen. Is it usual that this happened, or it was just today? So give some time, make your analysis, gather data, and make the decision is if it's worth having this conversation or not. If it's just a blaming, if it's not just a blaming game, if you want to solve a problem, if you want to solve a situation, if this will contribute to the better working of the practice, then go for it. But if it's just a blaming game, maybe it's just a question of you having the being on top and making your point. So I think this is very important to distinguish between efficiency and perfection. And I'm going to give you an example, for example, of a colleague that I worked already a few months ago, and one of his things, the struggles that he was having with his assistant about putting the photographs, on he found a way of organizing all the photographs, but he wanted the photographs to be put it on the drive every day. So in the end of the day, there was one person responsible for putting all the photographs, and of course that didn't happen. So like when he was with the patient and he wanted to show a case, an example, he was going to look for it, and the photographs were not there. And this became repetition. And when I asked, is that written? Is that part of the protocol? Was that, when did you tell them that? It was like between appointments, or is that on the? And so of course it was not done. So everything was he arranged everything to be in a system. He taught her, because sometimes you also expect things from people that they don't know how to do, or they don't have time to do it. So that's very important also, because you expect not only efficiency for someone, you expect perfection without even explaining or giving the conditions for the person to do that job. So before even to make the distinction between efficiency and perfection, you have to know if the person has the knowledge and the conditions to do an efficient job. Because sometimes what happens, and I see it, I think this with dentists is so common, you expect the other person to do exactly what you do. I hear this from dentists a lot. If it was me, I would never do that. How could I leave the practice and leave the material all over the place? I would never do that. It's a question of doing your job well done. But she's not you. He's not you. So don't expect that. Don't expect that.
Yeah.
You have to learn. You have to say to people what you want. Those things have to be written. That's the core of your practice, the way that it works.
Exactly.
So you should have a manual. You should have meetings. You should have also, and this is very important. And this is something also that's that you already said that it. I remember in the beginning of the podcast you said it's something that I have to work on. I don't know if you do this or not, but to have meetings with the staff in an individual way,
one-on-one,
not
yes.
one-on-one, because every person is a person, and on a staff with all the meeting with all the staff, there are things, and when you have meetings on one-on-one, you can coach them in a different way. So
and also realize what they what they expect from the future in this
That's
in
it.
this
That's it. So I
company,
think
right?
that
What
for what
they
you
would
said,
like,
for
what they
what you said,
value. Is it time?
so I think for what you said, these two distinctions are very important: perfection and efficiency. And what you want from the conversation, is that conversation or that confrontation worth having?
Worth having.
What do you want to have a do you want to have a blaming game, or do you want to solve problems? If you want to solve problems, you have to go to the conversation with a solution. You have to go to the conversation with the capacity of putting yourself on the other person's shoes.
Yes.
Otherwise, it will be like you said. It will be just to talk about the problem. You know those practices when they even have meetings. We have monthly meetings in our practice, but there's nothing done. Why? Because they only talk about the problems. They are talking about
Yes.
the
It's very
things that
common.
are. It's like a never-ending conversation. It's not like a never-ending conversation. So I don't know
Yes.
if you agree with that with that what I said, but I think this is very important, especially this
Yes, it's
distinguish.
yeah. I think it's main things are mainly about prevention, right? I think if you have systems in place and if you have monthly or bi-monthly or every 3 months meeting with full staff and the one-on-one meetings, which is like I said, yes, it was something that I worked on. It makes a huge difference. Um, but yes, it's mainly about prevention. It's mainly about prevention.
Do you know one big mistake that I think that sometimes dentists do, and this is not only practice owners, it's also dentist associates that work with all the dental staff, right?
Yeah.
Is that when something happens, they don't say anything about it, and they might even think that they are acting like based on empathy. It was a hard day, or
Yes.
I don't. Uh, and
Yeah,
this is
which
one of
brings
the
us to
things
the
that
opposite part.
yeah,
Yeah.
this is one of the things that I learned. The If you let it, those things,
Grow.
it will be one day and another day, and one day you blow up. And if you
Yes.
don't act accordingly, you don't act, but you will be thinking about it. And the next day, you will be
Yes.
looking at that person already with a different look, because that will be in your mind. And she will do it again, and that feeling will grow. So if you are assertive, you should. And I have this answer when I say this to colleagues, to dentists. They always say to me, "Yeah, but then I have to say the same thing 50 times." You say, and then you say things 50
No,
times.
you don't. Yeah.
But
Yeah.
but look, but if you, for example, have one-to-one meetings, you can talk to that person and you can coach it. You can coach that person, because
Yeah.
you as a dentist, and again, you don't have to be a practice owner. Even if you don't have a practice owner, you work with an assistant, right? And you work with a person, and
Yes.
the way that you work has to match. So if you are always working with a person and that person is doing something that you don't like, you have to be able to have a conversation with that person, and explain it to her. So that's an opportunity for you to coach that person, and for you to also teach her something, in order for you to be able to reach a point of agreement and of working together.
Yeah.
So don't let these things slide, because otherwise they will they will just grow and pile on each other, and you start looking at the person in a different way, and with you bring the negative feeling that you were talking about. And then when you have the conversation, is already going to be an explosion, and that's
Yeah.
not good. And that's, yes,
Yeah.
that is a difficult confrontation.
Yeah. And I was taking some notes here. Um, well, ideally, you should always be backed up by written systems. Like everything, every little thing should be backed down by systems. Even sometimes the things that you believe that are very stupid, all of them they should be backed up by written systems. And also, I think that you should also allow yourself to be influenced by their feedback, which is the are not only a decision of yours, but they are a decision of the contribution of everybody, right? And I think that your opinion or your conversation is much more valued if those persons understand that they feel heard, that actually their opinion matters, and that they feel respected. I mean, some things are sometimes very complex. For example, if you have like a grumpy face on your day for 10 hours, of course that the way that you relate to that nurse is going to be a little bit different, right? So sometimes we forget that we should try also to bring some positive energy to every situation. I mean, if something is going bad, does the nurse feel that when the shit hits the fan, that you try to help her, that you understand, that you are taking care of the situation, or when the patient is a little bit like gagging or something, can you eventually handle the situation and help the nurse that feels more nervous or something like it? Does she feel that you actually have a protective role with her? Because all these small things, they add up when you say something, because you basically, and I used to say this, the best way to influence someone is to let that person influence yourself. So are you mindful of the well-being of the other human being that is in your team that works with you? I mean, the more helpful you are to your nurses, the more helpful they will be to you. The more they feel that you are aware of their well-being, the more they will be the more they will be also aware and try to help your own well-being. So this is really basic, right? So sometimes we forget that as well, right? I mean, if we behave like assholes, then we cannot expect that people behave like very positively with us. But sometimes, and I was writing here, when does the confrontation lead to drama, or when, for example, you call someone, you say something, and even though you know that you are right, and even though you know that you did everything right, because you are not always sure, but if you believe that you were careful enough to talk to that other person, that you were aware of what you are doing, and there is like a negative response, or the patient or the other person gets grumpier, even though that they know they needed to do that thing. I think that often happens when there is a change in your behavior. When, for example, you have, I mean, there was a given way of dealing with things. Like there was the people won't talk about the issues for many years. So then the dentist or the nurse comes and does a course with us. And then all of a sudden they go to the practice in the next week and everything changes, right? I mean, you can't do that. You need to have an introduction of the new procedures. You need to have a meeting with the staff and say, look, I think there's some things you need to change. We will be maybe pointing out some situations in order that everybody has a better working environment, and we will do some changes here. And this might be difficult for some people. And of course, in the beginning, it's gonna be like that, right? In the beginning, it's gonna be like that. You cannot all of a sudden arrive in a team and just start to behave differently, or have someone that has a complete different way of dealing with things. Things need time. They need adaptation stages, right? And the other thing is, the other way that things can go wrong, even though you did everything right, is when you have a new staff, a new nurse. And here we need to talk about the onboarding process. So the onboarding process, again, let's go back to the systems. Ideally, they should be on the initial period where they are just seeing what happens, and they should also go home and read the manual, like parts very important of the manual. Ethical conduct, body language, what you say, what you don't say, all the basic rules of behavior in your practice, they should be written down. Okay, so if there is a good onboarding for a new nurse, I guarantee you the drama, and when you call out someone, there will be much less drama, right? But now let's make a even more extreme situation. You think that you did everything right, and we are just dealing with someone that is that just gets grumpy whenever there's a conversation of, and the conversation was balanced, and just because there was something that they need to do, they knew that they need to do, it was clear, and it is like an ongoing issue, right? So you believe that you did everything right, and you believe that whenever you talk to that nurse or to that doctor, they get grumpy, they do a grumpy face, and you can feel that. What would be your advice in those situations? Because this really can be overwhelming, and there's a lot of emotional erosion inside you because you, like you're saying, you go home, you think about this. So if you have a staff member that you realize that once or twice does this has like a negative response, and you can feel the end that they don't like that, what would be your advice to that?
I think I would advise to ask questions and understand the problem, or if there is a problem, and maybe in a one-to-one conversation, maybe in a individual way, and I would be very straightforward in what I was feeling, or what I was
Feeling.
receiving back, what I was receiving, or what I was sensing. Okay, this is not the first time that I tell you this. I see that you are not happy, or every time this is mentioned, or every time that this is brought to your attention, you don't have a very positive reaction. What's going on? Is there a problem? So I think that asking question and trying to understand
Yeah.
the problem would be my first advice, and also and take it from there. Obviously, but I think that, and also we have to say that there are certain
Yeah, extreme
sometimes there are certain
situations, of course.
yeah, there are certain situations and certain people that
For sure,
we
yeah, yeah,
don't match, and we don't have to, and the work don't match with the
yeah.
person. But I think it's very
And that
important,
can,
if you feel something like that, to really ask questions and try to understand the what's going on.
and also I would also add to that, just to positively contextualize that. Like, look, um, I've been trying to point out this and this, and the reason that I do that is because of this and this. Because I think it's better for the business, for the staff, for everyone. So this is why I think this is important to be done, and this is written. So, and I feel that your reaction is not very good. Is there any issue? Because sometimes that other person may be pointing out that, I mean, there's an issue because, yeah, but you don't, for example, yeah, but you don't say this to other people that do the same thing. Maybe you were not aware that some other people was doing the same thing or something. Maybe they are jealous of someone else. Maybe they are jealous because you treat someone in a way and the other one in a different way, which is also, I mean, that can be a problem, right? You need to make sure that you are balanced in the way that you treat the people. You should not have like preferred nurses, which actually could be a very good subject for a podcast, like to have preferred staff members. Yeah.
And
So,
also
I
the
mean, there,
onboarding process that you were talking about, I think it's very important. We could talk
yeah.
more about that, the
And
onboarding.
yeah, and so sometimes you may eventually, when, like you say, when you ask questions, you may eventually find out that, yeah, there are things that you were doing wrong. There are things that you were not aware. And I think that a good way to end this, and let me ask you this, is some of the people here, they are hearing us, and I'm trying to place myself on their feet, and they are saying, some of them, they are very young, and this seems very easy. I'm going to open a practice. I'm going to do this, right? Some of them, they already have a practice and say, look, I never did this, and it's going to feel awkward to start to having one-on-one conversations, which was what happened to me, right? And some other will eventually say, well, there's no way I'm going to have these sorts of conversation. I'm too old for this. I mean, I'm fed up with this. I mean, yes, it's very nice to hear these two guys talking about this, but it's just not for me. I'm just way too tired for this. And there's just so much going on here. And there's no way I could have like a balanced conversation because I'm so pissed off at the end of the day. I'm so tired. There's so much on my shoulders that I cannot have that calmness, that assertiveness to have this conversation. And I think this happens, I think this happens. There's a lot of, I think that some of the people hearing us, and when we talk about what would be ideal for us to do, it's just something that they are not willing to, or they think it's not possible. And my advice for them would be, no changes happen overnight. But I think that if you don't do anything, and if you feel there's something that is uncomfortable in your practice, the worst thing, like you were saying, is to be completely passive about that. Just let that grow. Because the problem is that in the long term, it's like a snowball. It just gets bigger and bigger and bigger until to a point where the energy in your practice, that really starts to affect you. And I think that humbleness and that willingness to have the conversation and to place sometimes your pride in your pocket, maybe some of the best things that you can do in your practice. I'm not saying that I do it every time. I do a lot of mistakes. But for example, having a one-on-one conversations with the staff was the best thing that happened to me over the last year. There's a lot of things that you can that you start to understand, and don't be afraid of that change. And I always like to say this: it's always better to feel nervous and that your voice trembles and that you blush, that you become red for 10 minutes. Then you need to turn yellow for 10 years. Because the things down the road are the most difficult things to solve. If you miss the opportunity to talk just because you don't feel the energy, you need to find the energy by eventually reducing your workload or having some morning off and you go to the practice just to have these conversations. Don't try to have these conversations in a full work day. And that's something that we've talked a lot also, which is like have a perfect day once a month where you only work in the morning or you don't even work, or have like a management day in the month where you take care of those issues. You go to the practice, you are more relaxed, you know that you don't have the stress of the procedure. Just go and try to plan these conversations, because in the future, this will bring you a lot of benefits for the team. That would be my advice.
Yeah. Yeah. I completely agree. If I can just add to what you said, I just want to add two things to what you said. It's just learn about it. Learn about communication. I mean, like, dentistry is all about communication. We, of course, we tend to focus on we dentists tend to focus on the techniques, but it's communication. You have to learn. These are tools. These are protocols. Also, like I said, when in our course, and we have we've seen that in every edition. It's like light bulbs going on their brains.
We role play.
Yeah, that's
And
it. So
role play, the two
we
of us.
teach,
Yeah, we
because these are
simulate some.
techniques. These are proven techniques. You can learn. You can practice them. You can apply them. Because what I see is that, and you mentioned not only young dentists, but also old
Yeah.
dentists. So the young dentists, just go for it. I will learn along the way. And the old dentists, I'm too or old or not. They don't have to be old, but the
Yeah.
older dentists,
Yeah.
I don't have the energy for this anymore. I've done it like this until now, and that's what I'm going to continue to do it. But it's you can learn. These are techniques, and you can learn. And dentistry, it's all about communication. It's about communication with the patient. It's about communication with your staff. Even if you are not a clinic owner, you have to have a good communication with the staff of the
Yeah.
clinics you work for. So just learn it, because if you just learn it with your experience, it's going to happen two things. First, you learn it with a lot of suffering. And second, you will learn it with bias. You will grow a lot of bias that you are not aware of, and you will fall in a lot of traps. For example, the traps of objectifying patients, and that the reason of your stress is patients, and the trap of that everyone has to do this, that's to work the same way that you work, and there's a lot of traps that you can fall in, a lot of bias that you can develop, and those are not right. So if you learn these techniques, and this is never late to learn, you will feel like it's, if you go, and it doesn't have to be 2-hour course, just buy a book on assertive or non-reactive communication. I can leave on the episode notes a few recommendations for that. Just do a course about non-reactive communication or assertive communication, and you will see that you will see, oh, this is it. And there are certain things that are very easy to solve. So because if you work on your communication, a lot of your problems on a dental practice will go away. Just like you say, Andrea, many times, the drama will diminish a lot on a dental practice if you work on the communication. And also, the second thing that I just wanted to add to what you said, I think that having one-on-one meetings with the staff is very useful, but you have to be careful with planning them. Just like you said, you have to plan them, because if you have this kind of conversation, like between patients, for example, so you are with an
Reactive.
assistant and you just close the door, then the other ones know that you are with closed door with that one, and then you have the
Yes.
meeting with that one, but then you on the
You don't
on the
have with the
next
other
few
ones.
weeks you do have to with the other ones, and that will create, you have to be aware of these
Yes.
things in a dental clinic. These
Yes.
things, again, communication, just the same way as gossip. It's very often that you don't want to have this kind of environment. So if you are going for one-on-one conversations, prepare yourself for them and plan them. So you should plan these conversations to be sure that they know that it's a one-on-one conversation. It's like you can call
Yeah.
it coaching or mentoring or whatever, but be sure that
Yes.
you plan with all of them, and that you know that the conversations are happening at that hour, so that they exactly what also to expect and to prepare. But I totally
Yes.
agree,
I,
you
I think
will you
I
will
think a
learn
good,
a lot from
yeah.
this person.
Something that helped me a lot, which is to email them. Look, I'm going to start to have this one-on-one, and in each one of these meetings, I'm going to make you this, and that question. It's about 3 or 4 questions, which is um, uh, the goals for you to stay here are short term, long term, or whatever. And I always said there's nothing wrong with that. Another one is, what do you think could be improved? What are the things that make you uncomfortable? And what's the most important thing that you want to get out of this job? And do you feel good when you come to work? Something things like that. And it's very interesting, the answers that they did. I have done like twice with which of them. It's very interesting because I feel there's a more human component present when you do that. I think there's a more human component. And another thing that I would like to add, I was thinking about, which is, I think that you should also balance the positive and the energy, the positive and negative energy. So, I mean, if you spend too much time in one day pointing out some issues, I think if you have a funny project, for example, I have a funny project I would like my dental nurses to participate in some of the social media videos in terms of oral hygiene tips and oral hygiene etiquette in public spaces and stuff like that. And this is a fun thing, right? So after a day where things were not that much fun, it's good to land to throw that subject in the next day, because I think it lightens things up, and it also, you send her the clear message that you are able to let things go. You understand that? Okay, yeah, we had a bad day, but it's fine. Things will go on, and we'll let this go.
Yes, yes. I think to end on a positive note, I think it's very useful to end that conversation with a positive note, and with a sense of, it's just like you said, even if the conversation is not very positive, and there are certain things that
Yeah,
need to be said in order to get
the way
better
that you end it.
at your work, to end things in a positive note, I think it's always a good thing. Always a
Yeah,
good thing.
very important. Yes. All
Okay,
right.
good.
It's and that would be the perfect invitation for our course in March. That would be,
Yes,
something. The more that I do this podcast and I'm going to do the course, the more that I am convinced that what the experience that we provide to participants in March, it's a genuinely very positive and very helpful experience. The more that I do this podcast with you, the more that I'm aware of the importance of the course that we do. And let's be honest, we started to do this not for, financial reasons are not the reason why we do it mostly. We go there because
no,
it's a nice place, we have fun. It's very cool to talk about these things, and to condense it, and to give a structure to all this
yeah, and
these
it's also
open things that we
the
talk about here.
I think for me, I don't know if you feel the same, but for me it's very rewarding, and it's very, I just feel like a good energy, and because
Yeah.
you see that, I think that the dentists are eager for this kind of knowledge, so I think that
Yes.
when they
Yes.
inscribe for the course, they
Yeah.
don't really know what
No.
to expect. They know that they need
Yeah.
something, and then when
Yeah.
we start adding, and it's like pieces of the puzzle coming together, and you see,
Yeah.
like, in their faces, the difference from the
Yeah.
first day
I
to
was.
the last day.
Yeah.
And it's very,
I
I
was
think
even.
this kind of knowledge, I think that there's a lack
Yeah.
of, they are very eager for it.
One of the things that by doing this podcast I realize is that of course that I do that my main financial relationship with dentists is about the technical part. I mean, I do a lot of courses, but I really feel this thing that I do with you, the soft bites, has been probably that projects to dentists that we are still talking about something very new. Dentistry is still a new profession, and in
But
Portugal
it's
it's still very
amazing
new.
how is that is, because like we were just saying, communication, you don't have
Yes,
dentistry without communication. You
no,
don't have, yeah. And it's amazing how
yeah, but I
just
do feel
now we are finding this
into
conversations
yeah,
important.
yeah. But it's one of the things that I really have the notion that for some people it's like, I mean, what is it talking about? What are they talking about? I just want to learn to prepare teeth, or just open a cavity, or just place an implant. And it's one of the things that I am completely aware that for many people it's something strange, it's something weird, but it's probably one of the things that I am more than ever sure. It's like when you talk to a patient, I mean, you just don't do what they want, you do what they need. And I really think that dentists today, they really need this. They really need, not from me or from you, but from whoever they can learn. They really need to look at this sort of situation, because the impact that this has in their personal, professional life and financial life, it's so huge. It's so huge that I really wish. And that whenever I talk about things, I always think, I mean, if I was 20 years old, what kind of things would I have liked to be hearing? And this is exactly why we are doing the course and the podcast. So the course is on March. The days are
March 21, 22, and 23 of March. And is in Sagres, in beautiful south, small
yes,
village
of
of
course,
Portugal, with the ocean view. We have a beautiful
yeah.
room with the ocean view. And if you want more information, just go to softbites.online. But yeah, I mean, communication is a big part of the course, and not only the communication techniques, but also what we said before for things to be, for the communication to be easier. It's not only about the technique, but also things should be written. So the written communication is also very important. And so we join these two worlds together, and you will see that a lot of things that you find difficult, and a lot of the challenges that you have during the day with your patients or with your team, even if you are not a dental practice owner, you will have the answer. You will have the answer on our course. So there will be a lot of situations that you will identify, and you will say, "Ah, yeah, I this happens to me, and how can I solve it?" And you will have the answer for a lot of situations. So yeah, join us. Go to softbites.online. You'll have all the information, and we will be very happy to have you and to receive you.
Perfect. Perfect. Okay, Manuela, see you
Thank
on the
you.
next episode. Thank you so
Thank you
much again.
everyone. Thank you everyone for listening. Bye bye.